Hello and welcome everyone. In this video, we will be talking about Lesson 5. Recording medical documents. Introduction to the medical record. Medical records are a crucial part of a medical practice. A medical record is a written record of the important information regarding a patient, including the care of that individual and the progress of his or her condition. A patient is defined as an individual receiving medical care. The patient's medical record serves many important functions. The physician uses the information in the medical record as a basis for decisions regarding the patient's care and treatment. The medical record documents the results of treatment and the patient's progress. The medical record provides an efficient and effective method by which information can be communicated to authorized personnel in the medical office. The medical record also serves as a legal document. The law requires that a record be maintained to document the care and treatment being received by a patient. If something goes wrong, good documentation works to protect the physician and the medical staff legally. Incomplete records could be used as evidence in court to show that a patient did not receive the quality of care that meets generally accepted standards. The medical assistant must always keep in mind that the information contained in a patient's medical record is strictly confidential and must not be read by or discussed with anyone except the physician or medical staff involved with the care of the patient. See highlight on the HIPAA privacy rule. Components of the medical records. A medical record consists of numerous documents. Each document in the medical record has a specific function or purpose. Most of these documents are pre-printed forms or computer templates that contain specific information entered by a physician or other health professionals. A large variety of forms or templates are available. The type of form or template used is based on the specific requirements of each medical office. Medical record documents can be classified into categories. Each of these categories is outlined in the box on page 872 along with the specific documents included in each. It is important that the medical assistant be familiar with each type of document in the medical record. A description of the function or purpose of each type of medical record document follows, by category, along with the specific information that each contains. Highlight on the HIPAA privacy rule. What is the HIPAA privacy rule? The acronym HIPAA stands for the Health Insurance Portability and Accountability Act. HIPAA is a federal law consisting of several components, one of which contains provisions to protect a patient's privacy, known as the HIPAA privacy rule. The HIPAA privacy rule went into effect on April 14, 2003. The primary purpose of this rule is to provide patients with better control over the use and disclosure of their health information. All healthcare providers, health plans, and healthcare clearinghouses, example billing services, that use, store, maintain, or transmit health information must comply with this rule. What is included in the HIPAA privacy rule? The HIPAA privacy rule is outlined here as it relates to the medical office. The medical office must develop a written document known as a Notice of Privacy Practices, NPP. The NPP must explain to patients how their protected health information, PHI, will be used and protected by the medical office. Protected health information includes health information in any form, written, electronic, or oral, that contains patient-identifiable information, example name, social security number, telephone number. The medical office must make a reasonable effort to provide an NPP to each patient and to obtain a signed acknowledgement from the patient that he or she has received an NPP. A patient's written consent is not required for the use or disclosure of PHI for the following. Medical office administrative documents. Administrative documents contain information necessary for the efficient record-keeping management of the medical office. Medical office administrative documents include the patient registration record and patient-related correspondence. Patient registration record. The patient registration record consists of demographic and billing information. All new patients must complete a patient registration record form. After the patient completes the registration record, the medical assistant enters the information into a computer. This allows the demographic and billing information to be used for numerous computerized functions, such as scheduling appointments, posting patient transactions, and processing patient statements and insurance claims. With a paper-based patient record, PPR, the original patient registration record is then usually placed in the front of the patient's medical record. With an electronic medical record, EMR, the original registration record is usually shredded. Patient registration form sample. NPP acknowledgement form. A Notice of Privacy Practices, NPP, is a written document that explains to patients how their protected health information will be used and protected by the medical office. The patient must sign a form acknowledging that he or she has received the NPP. The NPP form is then filed in the patient's chart. Correspondence. Correspondence is an important part of the medical record. Correspondence regarding a patient may be received from various individuals or facilities, such as the patient's insurance company, the patient's attorney, and the patient himself or herself. Insurance correspondence includes such documents as a pre-certification authorization for a hospital admission and a request for additional information from the insurance company. Correspondence also includes copies of letters concerning the patient that are sent out of the office. Examples are a copy of a letter referring the patient to a specialist and a copy of a collection letter sent to the patient. Medical office clinical notes. Medical office clinical documents include a variety of records and reports that assist the physician in the care and treatment of the patient. Common medical office clinical documents are listed and described next. Health history report. A health history report is a collection of subjective data about the patient. Most of this information is obtained by having the patient complete a pre-printed form. Medication administration record. Consultation report. A consultation report is a narrative report of a clinical opinion about a patient's condition by a practitioner other than the primary physician, known as a consultant, Figure 36(3). The consultant is usually a specialist in a certain field of medicine, for example cardiology, endocrinology, urology. The consultant's opinion of the patient's condition is based on a review of the patient's record and an examination of the patient. The consultation report must include the following: documentation that the consultant reviewed the patient's health history, documentation that the consultant examined the patient, a report of the consultant's impressions, any care or treatment provided by the consultant, a report of the consultant's recommendations. Laboratory documents. A laboratory report is a report of the analysis or examination of body specimens. Its purpose is to relay the results of laboratory tests to the physician to assist in diagnosing and treating disease. The specific categories of laboratory tests include hematology, clinical chemistry, immunology, urinalysis, microbiology, parasitology, cytology, and histology. Diagnostic procedure documents. A diagnostic procedure report consists of a narrative description and interpretation of a diagnostic procedure. A diagnostic procedure is a type of procedure performed to assist in the diagnosis, management, or treatment of a patient's condition. The procedure may be performed by a physician, the medical assistant, or a technician specially trained in the procedure. A physician is responsible for interpreting the results of the diagnostic procedure and completing the written report. Examples of diagnostic procedure reports follow. Electrocardiogram report. An electrocardiogram (ECG) report is a narrative description of a cardiologist's interpretation of an ECG, including the implications for the patient. The graphic tracing is usually included with the report. Holter monitor report. A Holter monitor report is a narrative description of the interpretation of a 24-hour ambulatory ECG, including the evaluator's impressions. Portions of the graphic tracing are usually included with the report. Sigmoidoscopy report. A sigmoidoscopy report is a narrative description of the interpretation of a sigmoidoscopic examination, including the practitioner's impressions. Hospital documents. Hospital documents are prepared by the physician responsible for the care of a patient while at the hospital. This physician is known as the attending physician. The attending physician may be the patient's regular physician or a different physician. An example of the latter is a physician attending a patient at an urgent care center or in the emergency department of a hospital. Hospital documents are dictated by the attending physician and transcribed at the hospital. The original document is filed in the patient's hospital medical record, and a copy is sent to the patient's regular physician. Hospital documents assist the patient's physician in reviewing the patient's hospital visit and in providing follow-up care. History and physical report. The term inpatient refers to a patient who has been admitted to the hospital for at least one overnight stay. A health history must be obtained and a physical examination performed on all inpatients. There is one exception to this: if a patient history and physical examination are performed at the medical office within 1 week before admission, a copy of these documents may be used. In the event that a reliable health history cannot be obtained from the patient, it must be obtained from the person best able to relay the facts. A physician's narrative account of the patient's history and physical examination, as well as the physician's medical impressions, is called a history and physical report. The history is used to chronicle the patient's current complaints and symptoms, whereas the physical examination is used to determine the patient's current health state. Medical impressions, or simply impressions, are judgments reached as a result of data analysis. In this situation, the physician evaluates the information gathered from the patient's medical history and physical examination to reach judgments about the patient's health. Provisional diagnosis and preliminary diagnosis are two more words for perceptions. Operative report. This report describes the surgical procedure and must be completed and signed by the surgeon who performed the operation. The operative report must include the following: patient identification information, date and location of the surgery, consent to treatment form. This form must be signed by the patient or his or her legally authorized representative and must provide written evidence that the patient agrees to the procedure or procedures listed on the form. For the patient's consent to be valid, it must be informed consent. Informed consent means that the patient has received the following information before giving consent: the nature of the patient's condition, the nature and purpose of the recommended procedure, an explanation of risks involved with the procedure, alternative treatments or procedures available, the likely outcome, prognosis, of the procedure, the risks of declining or delaying the procedure. The explanation must be given in terms the patient can understand, and the patient should be given an opportunity to ask questions regarding the information. The consent to treatment form should not be signed until the patient has been provided with all necessary information related to the procedure. The patient's signature must be witnessed. This is usually the responsibility of the medical office assistant. Witnessing a signature means only that the document is legal. Release of medical information form. As previously explained in the box entitled Highlight on the HIPAA Privacy Rule, a patient's written consent is not required for the use or disclosure of protected health information, PHI, for the purpose of medical treatment, payment, and healthcare operations, TPO. If a patient is moving to another state and wants to transfer his or her medical record to a new physician, a release of medical information form must be completed. If the patient is a minor, the form must be signed by the parent or legal guardian of the minor. The release of medical information form must stipulate the following: The patient's full name and address. Name of the medical practice releasing the information. Name of the individual or facility to receive the information. Specific information to be released. The purpose of or the need for the information. Method of release of the information. Signature of the patient or his or her legal representative. Release of medical information. All information contained in the medical record is confidential, and the release of information is closely controlled. A properly completed and signed authorization form is required for the release of the following information. Mailed or faxed requests for release of medical information. These steps should be followed when a completed release of medical information form has been mailed or faxed to the medical office. Procedural step. Check the expiration date on the release of medical information form. If the authorization is outdated, a new release form needs to be completed. Procedural step. Verify the authenticity of the signature on the form. This can be accomplished by comparing the patient's signature on the form with the patient's signature in his or her medical record. If you have any doubt as to the authenticity of the signature, do not release the records. Procedural step. Copy the information requested on the form. Release only the information requested. Include a copy of the completed release form with the medical information. Procedural step. Document what information is being released and the date of its release. Sign the document with your name and credentials. Procedural step. File the original document and the release of medical information form in the patient's medical record. Procedural step. Send the medical information according to your medical office policy. Types of medical records. Medical offices may rely on the use of paper medical records, known as paper-based patient records, PPRs. Although most of the medical record is paper-based, some patient data are maintained on the computer. These include patient registration information and patient charges and payments. As technology advances, more and more offices are converting to an electronic medical record, EMR, for maintaining patient health information. With an electronic medical record, the entire record is stored in a database on the computer, including the health history report and physical examination report, progress notes, laboratory and diagnostic reports, and hospital reports. The electronic medical record is discussed further in the next section and in chapters 38 and 41, whereas the remainder of this chapter focuses on the paper-based patient record. Electronic medical record. The electronic medical record is a computerized record of the important health information regarding a patient, including the care of that individual and the progress of the patient's condition. Making the transition to an EMR is a major undertaking for a medical office. Medical offices are gradually moving toward the EMR. Approximately 51% of the medical offices in the United States have converted to an EMR, and this percentage is expected to increase over time. The biggest deterrent is the financial and time investment required for a medical office to make the conversion to the EMR. EMR software allows for the creation, storage, organization, editing, and retrieval of medical records on a computer. The EMR software is usually linked to the practice management software. This allows the EMR to communicate with the practice management software and facilitates certain administrative tasks such as billing and insurance. Refer to Chapter 38 for a detailed discussion of the electronic medical record. Medical record formats. The way a medical record is organized is known as its format. The two main types of medical record formats are the source-oriented record and the problem-oriented record. Each of these formats is described. Source-oriented record. In the medical office, the source-oriented structure is most used to organize a medical record. A source-oriented record's documents are divided into sections based on the department, facility, or other source that created the data, for example, laboratory, hospital, or consultant. It's simple to compare information from laboratory and diagnostic test results, evaluations, and therapies since records from each source are kept together. Within each of these sections, the documents are arranged according to date. Most offices use reverse chronological order to arrange the documents. Reverse chronological order means that the most recent document is placed on top or in front of the others, and thus the oldest document is on the bottom or at the end of that section. Source-oriented record. The titles that identify each section vary depending on the medical office's preference. However, typical examples include the following: History and Physical, Progress Notes, Medications, Laboratory Reports, ECG, X-ray Reports, Consultations, Rehabilitation Therapy, Home Health Care, Hospital Reports, Insurance, Consents, Correspondence, Miscellaneous. Problem-oriented record. A problem-oriented record, POR, or problem-oriented medical record, POMR, is a collection of records grouped by the patient's health issues. The POR has the benefit of allowing each of the patient's issues to be identified and tracked separately. The POR goes through 4 stages: establishing a database, compiling a problem list, devising a plan of action for each problem, following each problem with progress notes. Progress notes. The progress notes begin with the number of the problem and include the following 4 categories: subjective data obtained from the patient; objective data obtained by observation, physical examination, and laboratory and diagnostic tests; assessment, the physician's interpretation of the current condition based on analysis of the subjective and objective data; plan, proposed treatment for the patient. Progress notes. SOAP is the abbreviation for this technique, and soaping is the act of producing progress notes in this manner. Some clinicians who employ the source-oriented style have discovered that recording progress notes in SOAP format is more efficient. The physician's ability to deal with each situation clearly and evaluate data in an ordered, methodical manner improves with this organized sort of note. The acronym for this process is SOAP, and the writing of progress notes in this format is called soaping. Some physicians who use the source-oriented format have found it advantageous to record progress notes in SOAP format. This structured type of note increases the physician's ability to deal with each problem clearly and to analyze data in an orderly, systematic manner. Preparing a medical record for a new patient. The method used to prepare the record depends on the following criteria: the format used to organize the record, the filing system, and the type of storage equipment. Most medical offices use the source-oriented format to organize their medical records, the alphabetic filing system to arrange the records, and shelf filing units to store the medical records. Methods used to prepare a medical record are described in the following sections and are based on these criteria. Medical record supplies. Certain supplies are required to prepare a medical record. These supplies are categorized and described next. File folders. A file folder is a protective cover made of a heavy material such as manila cardstock. A file folder is used to hold medical record documents in an organized format. Flexible metal fasteners are typically used to hold documents in the folder. Folders are available with fasteners located on the top or left side of the folder. Folders are available with tabs. A tab is a projection extending from a folder that is used to identify its contents. The tab can be found on the folder's side or at the top. A full-cut tab is a folder with a tab that runs the length of its side or top. A file folder with a complete cut side tab is frequently used in the medical office to compile a new patient's chart. There are indentations at regular intervals throughout the whole cut tab to indicate where sticky labels should be placed. This guarantees that all medical records labels are placed in the same spot on the file folders. Folder labels. Labels to identify the medical record are commercially available on 812x 11-inch sheets for use with a computer and printer. The types of labels most commonly used in the medical office include name labels, alphabetic color-coded labels, color-coded year labels, and miscellaneous chart labels. Chart dividers. Dividers consist of a heavy material such as manila cardstock. Attached to each divider is a color-coded tab labeled with a subject title. The most frequently used subject titles are illustrated in the accompanying box, along with the documents typically filed under each title. Outcome of patient recording. The following procedure outlines the method for preparing a medical record for a new patient using the following organization: a source-oriented format stored in shelf files using a color-coded alphabetic filing system, equipment, or supplies. Patient registration form. Notice of Privacy Practices, NPP. NPP acknowledgement form. File folder with a full-cut side tab. Metal fasteners. Name labels. Procedural step. Greet the patient when he or she arrives at the medical office. Introduce yourself and identify the patient. Verify that the patient is a new patient. Procedural step. Ask the patient to do the following. Complete a patient registration form. Read a Notice of Privacy Practices, NPP. Sign an NPP acknowledgement form. Procedural step. When the patient returns the completed forms, check the patient registration form for accuracy, and make sure that you can read the patient's handwriting. If you have any questions regarding the information on the form, ask the patient for clarification. If required by the medical office policy, ask the patient for his or her insurance card and make a copy of it. Principle. A copy of the patient's insurance card is used for third-party billing. Procedural step. Enter into the computer the data on the completed registration record. Enter the patient's name in transposed order as follows: last name, first name, middle name, or initial. Enter the patient's name 2 or 3 spaces from the left edge of the label and 1 line down from the top of the label. Ensure that the patient's name is spelled correctly. Principle. Following these guidelines facilitates the accurate and efficient filing of the patient's medical record. Procedural step. Determine the first 2 letters of the patient's last name and select the appropriate alphabetic color-coded labels. Attach the color-coded labels to the Full Cut side tab. The labels should be affixed to the folder using the label placement indentations on the tab. Principle. Using the label placement indentations ensures that all labels on medical records are affixed at the same place. Procedural step. Affix the name label immediately above the first color-coded alphabetic label. Color-coded alphabetic barred labels miscellaneous set of chart dividers blank pre-printed forms 2-hole punch. Affix the name label. Procedural step. Attach any additional chart labels, such as a year label and miscellaneous chart labels, for example allergy, insurance, to the folder according to the office policy. Procedural step. Insert the chart dividers onto the metal fasteners of the file folder. Procedural step. Place the original patient registration form in the front of the medical record. Place the signed NPP acknowledgement form and the copy of the patient's insurance card in the appropriate section of the record. Procedural step. Label pre-printed forms to be placed in the record with required information such as the patient's name and date. These forms typically include the medical history form, the physical examination form, progress note sheets, and a medication record form. If the forms are not prepuce, the medical assistant must use a 2-hole punch to insert 2 holes into the top or side of the form. Procedural step. Insert each form under its proper chart divider. Refer to the box below for a list of chart divider subject titles and documents typically filed under each title. Procedural step. Check the medical record to ensure that it has been prepared properly. Place the patient registration form in the front of the medical record. Taking a health history. The health history is a compilation of subjective health information gathered by interviewing the patient and having the patient fill out a pre-printed health history form, which is then verified by the medical assistant for accuracy. Each new patient has a comprehensive medical history obtained, and subsequent office visits, in the form of progress notes, offer updates on the patient's disease or treatment. The patient is more likely to talk honestly and openly in a calm, pleasant area with seclusion. Genuine interest and compassion for the patient decreases fear and makes data gathering easier. In an office with an EMR, the patient may complete a health history paper and pencil form, and the medical assistant then enters the data into the computer. An alternative is for the medical assistant to enter the information directly into the computer while asking the patient questions related to his or her health status. Although not yet in widespread use, computer-guided questionnaires are available for some patients to complete their own health histories. The medical office must provide a private area for the patient to complete the questionnaire, and the medical assistant must be available to answer questions. Components of health history. Components of the health history. The health history is taken before the physical examination is performed, providing the physician the opportunity to compare findings. The health history consists of 7 parts or sections. Case study. Christina Graham. During my externship as a medical assisting student, I was placed in a family practice clinic. I was very nervous my first day, wondering how in the world I would be able to remember everything I had learned in school. My first patients were an elderly couple. The wife was there for some test results for cancer. I looked at the results, and they were positive. After the physician relayed the results, the husband broke down. He had just lost his granddaughter to a heart attack and his son-in-law to a stroke. You could tell that he just could not bear losing his wife too. 1 week later, the elderly man's wife was placed in a nursing home. He came into our office for an appointment. As I was working him up, he was telling me stories about himself and his wife when they were first married. He looked so sad. I sat with him for a few minutes after completing his workup and gave his stories my full attention. As I was leaving the room, a smile came across his face, and he thanked me for listening to him. I realized that working in a physician's office is more than just knowing what I learned in school. Compassion and showing patients you really do care about them are just as important. I felt good about myself that day. Charting in the medical record. Charting is the process of making written entries about a patient in the medical record and is performed by medical office personnel who are directly involved with the health care of the patient. The medical record is considered a legal document. The information must be charted as completely and accurately as possible. Developing good charting skills requires a thorough knowledge of charting guidelines combined with much repeated practice. To provide guidance in attaining this important skill, PPR charting guidelines are presented in this section, followed by examples of proper charting entries. With an EMR, the medical assistant enters charting information into a computer using free text entry, drop-down lists, and checkboxes. Charting progress notes. After completion of the initial health history, a system is needed to update the medical record with new information each time the patient visits the medical office. Most offices use progress notes to fulfill this function. Progress notes document the patient's health status and the care and treatment being received by the patient in chronological order. Progress notes provide effective communication among medical office personnel and serve as a legal document. The medical assistant is frequently responsible for charting progress notes in the medical record. Types of progress notes that are often charted by the medical assistant are presented next, along with a charting example of each. Charting patient symptoms. The medical assistant takes patient symptoms during office visits and telephone conversations. Information conveyed during a telephone conversation helps the medical assistant determine whether the patient needs to be seen and the immediacy of the situation. A symptom is any change in the body or its functioning that indicates the presence of disease. Symptoms can be classified as subjective or objective. A subjective symptom is one that is felt by the patient and cannot be observed by another person. Pain, pruritus, vertigo, and nausea are examples of subjective symptoms. An objective symptom is one that can be observed by another person and by the patient. Rash, coughing, and cyanosis are objective symptoms. The medical assistant should have a thorough knowledge of common symptoms and should be able to recognize them. Table 36, 2 lists and describes common symptoms. Taking patient symptoms during an office visit consists of the following. Obtaining a chief complaint, see earlier discussion. Obtaining additional information about the chief complaint. If the patient complains of pain in the abdomen that has lasted for 2 days, chief complaint, additional information is needed to describe the pain, including its type, specific location, onset, intensity, precipitating factors, and duration. Administration of medication. Specimen collection. Each time a specimen is collected from a patient, the medical assistant should chart the date and time of the collection, the type of specimen, and the area of the body from which the specimen was obtained. If the specimen is to be sent to an outside laboratory for testing, this information also should be charted, including the tests requested, the date the specimen was sent, and where it was sent. In this way, the physician would know that the specimen was collected and sent to the laboratory when test results are not back yet. Specimen collection. Diagnostic procedures and laboratory tests. Diagnostic procedures and laboratory tests ordered for a patient should always be charted in the medical record. If the patient does not undergo the test, documented proof exists that the test was ordered. Charting diagnostic procedures and laboratory tests protects the physician legally and refreshes the physician's memory of the procedures and tests being run on the patient when results are not yet back from the testing facility. Information to include in the charting entry consists of the date and time, the type of procedure or test ordered, the scheduling date, and where it is being performed. Diagnostic or laboratory tests. Results of laboratory tests. It is usually unnecessary to chart results from laboratory reports returned from outside laboratories because the report itself is filed in the patient's record. In case of a stat request or critical findings, the test results may be telephoned to the medical office, requiring the medical assistant to record the results on a report form. Careful recording is essential to avoid errors, which could affect the patient's diagnosis. Results of laboratory tests performed by the medical assistant in the office should be charted in the medical record and must include the date and time, name of the test, and test results. Laboratory test results. Patient instructions. It often is necessary to relay instructions to a patient regarding medical care, for example wound care, cast care, care of sutures. The medical assistant should chart this information, taking care to include the date and time and the type of instructions relayed to the patient. Many medical offices have printed instruction sheets that are given to the patient. Other areas that the medical assistant is responsible for charting in the medical record include missed or canceled appointments, telephone calls from patients, medication refills, and changes in medication or dosage by the physician. Medical practice and law. Documentation can be a deciding factor in a legal case. Everything you do for a patient should be documented in a factual manner in the medical record or chart. When a legal issue arises, often several years pass before it comes to trial. If you are involved, you will be asked detailed questions as to your actions on a particular day for a particular patient. Few people have accurate memories for that long. Juries give more credibility to documentation performed at the time of the action than to a memory of years ago. Ethically, you owe the patient thorough documentation to provide optimal continuity of care. Remember that all patient information is confidential. Proper charting is a crucial skill for a medical assistant to master. Although proper documentation would not prevent a lawsuit, it might determine the outcome. This brings us to the end of this module. Thank you.